Metatarsalgia. What is metatarsalgia? This is a condition that can best be described as a pain in the ball of the foot, or pain in the metatarsal bones. This condition can have multiple causes. The metatarsal bones are the bones just behind the toes. Typically, a patient will present to the office complaining of pain in the ball of the foot, many times without any history of trauma. The foot will hurt to walk on, sometimes worse barefoot than in shoes. People will come in and complain of symptoms related to a callus, hard skin, that they have on the ball of the foot, asking me to trim it away. Of course, at times calluses can be the source of metatarsalgia, but more often than not the pain is coming from a level deeper than the skin. Conditions that cause metatarsalgia. Loss of fat pad. As we age, the one part of the body where we lose fat is the bottom of the foot. Normally the fat pad underneath the metatarsal bones cushion the foot. Once this padding is lost, a person is then literally walking on the heads of the bones. Bursitis. Further aggravating metatarsalgia is the fact that in an area of friction or pressure, many times the body will attempt to create a cushion to protect the area. This cushion is called a byssal sac. The problem is that as excessive pressure is placed on the byssal sac, it too can become inflamed and now is referred to as a bursitis. Capsulitis. Other times a patient will present to the office complaining of metatarsalgia type pain that just does not seem to be directly under any metatarsal head. Many times this metatarsalgia pain will be just distal, slightly in front, to the metatarsal heads, almost going into the toe area. In this case, we make a diagnosis of capsulitis, which is actually a stretching of the ligaments on the bottom of the foot that attach the metatarsal bones into the toes. Neuroma. Along similar lines, a patient may present to the office with complaints of a sharp pain which seems to radiate into the toes or back into the foot. There may also be associated complaints of burning and numbness. This can be suggestive of a neuroma or pinched nerve. Sesamoiditis. Many times a patient will come into the office complaining of a sharp pain in the ball of the foot that seems to be limited to just behind the big toe joint. The area may also be swollen and feel warm to touch. In this case, a diagnosis of sesamoiditis may be made. Stress fracture. Lastly, at times a patient may present to the office with pain in the ball of the foot. They may also have a swollen foot and part of the area may be red and very tender to touch. Even though they do not relate to a history of trauma, it is very common to sustain a fracture of one of the metatarsal bones. Treatment of metatarsalgia. Treatment depends on defining the source as already discussed. Generally, if the pain is from lack of a fat pad or just too much pressure on the metatarsal heads due factors like obesity or working on concrete floors, adding cushioning and support to the feet through the use of an orthotic should be very effective in reducing pain. If a diagnosis of neuroma, bursitis, or sesamoiditis is made, orthotics may also be very helpful. In many instances, a metatarsal pad or metatarsal bar may be added to the orthotic in an effort to take pressure off of the metatarsal heads. Either type of padding may be built into the top of the orthotic and will be placed just behind the metatarsal heads. In addition, anti-inflammatory medication or cortisone injections may be used as short-term therapies. I do not recommend anti-inflammatory medication as a long-term solution. Read the complete article at www.foot-pain-explained.com/metatarsalgia.html